Welcome to What the Health? Where anything health is fair game as we tackle the trends and bust the myths about health and wellness. Here are your hosts, Dr. Dan and Angela Toro.
And welcome to another episode of What the Health. I am Dr. Dan, here with my co-host,
Angela. Welcome back, guys. And do our little disclaimer here. As you guys know, we're here for informational purposes only, in no way offering individualized medical advice. Always talk to your trusted healthcare provider before making changes to your routine. Although on this one, I would say Dr. Dan should be your trusted healthcare provider, because today we are talking about something that everyone, whoever went through elementary school or middle school is very familiar with, which is the scoliosis check.
Scoliosis. I don't even think we came up with a fun title for this one, but yeah, we'll just jump right in.
So best way to diagnose scoliosis is just bend over and look at your spine, right?
Yeah, right now. Not quite. Well, let's first define this, and Angela's absolutely right. If there's one thing that I would consider myself somewhat of an expert in, it's the spine.
Which your patients should be happy to hear.
Patients should be happy to hear, so if you're listening, thank you. But yes, I do consider myself somewhat of an expert in that area. But when we talk about scoliosis, we're primarily talking about structure. So when you look at the spine straight on, okay, like from the back or from the front, whichever way you want to look at it, but when you're looking at the spine, front to back, back to front, it should be straight from top to bottom. So the head should be directly over the neck should be directly over the thoracic, which is the middle of the spine where all the ribs attach, and then that should be directly over the lumbar spine, which is your lower back, which should be directly over your tailbone and hips. So with that being said, when you look at your spine from the side, you should have some curvatures. People always, when I say, oh, yeah, your spine should be curved, depends on what direction you're looking at, okay? If you look at the spine from the side, there should actually be 3 healthy curves to it. You should have a forward curve in the neck, a backward curve in the middle of the back, and then another forward curve in the low back. And those curves actually help develop the shock absorption of the spine. And so, and it also helps to then protect that spinal cord, which is, we talk about all the time, is an extension of the brain. Okay, so you got the brain and the spinal cord, which is part of your central nervous system, again, which controls and coordinates all the messaging and communication within the body. So it's kind of important, right? So we're really talking about just, looking from that front to back or back to front direction. And a scoliosis is a structural dysfunction where the spine, whether it's in a little bit in the neck, can be, they're commonly found in the neck and the upper back or the middle of the back. You get a sideways curvature, okay? So the spine, instead of being straight from top to bottom, it starts to deviate, either to the left or the right. And in 80% of the time, okay, of scoliosis cases, okay, so 80% of all scoliosis cases are considered idiopathic, meaning they have no idea why it happens. So when we look at this, if we don't know why it happens,
can't really prevent it.
Yeah, it's hard to prevent it, right? So, but interestingly enough, I have some theories as again, as we are looking at this. But before we go there, let's get into, how is it checked right now? When you go into your nurse at school and they do these scoliosis checks, I don't even know if they still do.
I don't know. That's literally just all I think about is those. It was always a gym class.
Yeah, right. It's like, all right,
everyone
stand up straight. Okay, now bend over. Yeah. But interestingly enough. Well, that'll be another point I get to here. But yeah, so, the nurse would, the nurse or other healthcare practitioner, you'd stand, you'd go behind a curtain.
I hope they were a nurse.
Nurse or other healthcare professional, right? Yeah.
Who knows?
Joe Schmo, hey, whoever was available that day. Okay. You go behind the curtain and you flip your shirt up over your head, and then they'd look at you straight up and down, and then they'd have you slowly bend forward, and they'd see how does the spine look whenever you are, straight and then bending forward. So In severe cases of scoliosis, yes, you can see, pretty significant deviation of the ribs. You can see curvature of the spine, height of the shoulders, deviation of their head, hip alignment. One glute muscle is sitting way back or forward. So, but that's in more severe cases of scoliosis. Now, to be considered, a mild scoliosis case is, anything up to really like 25 degrees. Okay, which even 25 degrees, if you look at it on X-ray, is fairly substantial.
Yeah.
But that's actually considered in the actual textbook definition. A mild scoliosis is 25 degrees or less. So 0 to 25 degrees would be considered mild. Those are the cases, that again in young children, as their spine is developing. See, the spine doesn't hit maturity. Okay, the skeletal system, spine being included in that, doesn't hit full maturity until about 20 to 24 years of age. That's when, and again, it depends on male, female, and many different factors there, but on average, 20 to 24 years of age, that's when the spine is fully matured. Ligaments have stopped growing, muscles have gained their tension, the joints, the bones themselves have stopped growing, and so we've kind of hit this mature phase of like, that's the structure of the spine. But in that developmental process from 0, time you're born, all the way up until that spinal maturity process, you're growing, you're developing, you're adapting, you're changing. That is when we can get the greatest amount of change in those scoliosis or curvature cases. And we do a very specific X-ray analysis of looking at how are the hips and the tailbones rotated, because many times these scolioses are coming from the foundation and something is off in the tailbone or the hips. How it got like that? Well, we can go down a whole path of just take a look at my 2.5-year-old daughter who bounces on the trampoline and falls down on her butt, smacks her head off of the granite countertop. It's like, go into this myriad of, brutal physical traumas that all these kids
thinking
go
about
to.
The night we were at the table and she
three times
hit her head
she was
on the same spot of the table. I'm like, it's the same height. It hasn't changed.
She's underneath playing on the table with the dog or, doing something, and then boom, 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 3 times in a row within like a 10-minute time frame. It's like, oh, well, I'm going to have to look at that. But yeah, so that's, I'm going to go back to B.J. Palmer. Has a famous quote, right? That I get made fun of all the time because I misquote it, but I think I have it in my head today.
Yours is better.
B.J. Palmer had a quote that, as the twig is bent, so grows the tree. Okay? See, I did it. So if you go outside, you have like a little sapling tree that's starting to grow, and you go out and just maybe like tie it down so there's a little bend in it, then that tree, there's forces in there, that mechanical forces on the bark and on the trunk, that the tree will actually grow with a bend in it, and actually it'll start to grow sideways for a little while, and then it'll start to right itself and go back because it compensates. The same thing, the same amazing thing happens in the spine. So if you have, if let's say you have a slip and a fall and you land on your butt, well, the body self-adjusts all the time, right? We all get out of bed in the morning sometimes, we reach up and get a little pop or a prick or oh, what was that? It's like the body self-adjusts all the time, and this happens all the time. We've all picked a kid up and maybe felt their arms pop or their spine, you make a little pop or something. Like kids are they're noisy because there are a lot of cartilage growing around those bones. So the body shifts and moves because we're adaptable. And when you get to that point, another point in a minute, I should be writing all these points so I'm going to back you down. But the times when it doesn't, get corrected, it's not able to self-adjust. Well, now you have a misalignment, okay, or a lock where the spine, it gets stuck. And so now, because it's not moving properly, now the body continues to grow with this lock or this misalignment or subluxation in it. And so if the hips are, kinked, misdirected left or right, or up or down, now all of a sudden the body adapts to that. So maybe it's going to start growing sideways a little bit, you start developing this curvature, But again, because the body is incredibly adaptable, it may grow to the right for a little bit, but then it's going to compensate. And so up above will start to go back to the left because it's trying to get back to the center. The body will always try and keep the head over the hips. That's how it grows and develops, called the righting reflex. So if your spine starts to go a little bit sideways, it's not going to continue to have you grow that way, because then your head would fall over. So it rights itself, and that's where you start to get these curvatures in the spine. So anyway, you think about it. So that's the stuff that, with the analysis that we do, we can look at, misalignment of the hips and the tailbone, because a lot of times these scolioses, they start in the foundation. Just like if the foundation in your house cracks or it's off, well, you can start to get cracks in the wall or the chimney on the completely opposite end of the house because the foundation is off. And so the same idea, we look at the foundation, the tailbone and the hips is where the weight from your upper body is transferred down to the legs. So it's a very important area that force needs to be shifted from top to bottom and bottom up in order to keep a healthy, walk and ambulate and move yourself around. So we look at that, and we can start to monitor that. And so, rather than going, and checking with the school nurse, or just having those visual assessments are good, but it's really only going to catch those severe scoliosis cases. The ones that 25 to 40 degrees, that's considered a moderate scoliosis in the medical world, moderate scoliosis, and that's actually, the medicine will just monitor that, and they really, they might recommend some, just some core strengthening, physical therapy, but they're really just going to monitor it. If you start hitting 45 degrees or above, now you're actually considered a surgical case, because the long-term impacts, what happens is if you have that 40 degrees of curvature, that can start impacting your rib cage, depending on where the scoliosis is. If it starts closing down the rib cage, because if you think of a curvature, you've got a convex side and a concave side. Okay, think of a spoon, right? The side of the spoon that you put your food in or your soup in, that's the concave side, and then the underside of that spoon is the convex side. So same thing with scoliosis. If you've got this sideways curvature, you've got a convex side, which is the outside of the curve. You have a concave side, which is the inside of the curve. So if you're above 40 degrees, you can actually start to compress some of those organs, such as heart and lungs, and you can affect heart and lung function there if it's left too long. Now, again, it doesn't mean you're absolutely going to have surgery above 45 degrees. Again, it depends on monitoring. I have a couple patients that I work with that are very close to that, but again, we monitor. Every, if we know that you have a, moderate to severe borderline scoliosis, we monitor every 6 months to see how it's adapting and changing. And we have seen that this one girl that we're working with has kind of stayed in that 35 to 40 degree range over the last 6 to 12 months that we've been working with her. So that is something that when we align the hips, we might not get a complete change in structural correction there, but the big key component, going back to the school analysis, is they're only going to catch those more severe cases, and then,
which at that point you're basically trying to stop it from progressing any further.
Correct. Yeah, they're so the progression to worsening, but then they're going to miss all of these mild cases that could be 25 degrees or below. So it really comes down to, and the other thing then that's the big point I wanted to bring up. There's something called a structural versus a functional scoliosis. And what that means is structural means that it's pretty solidified, meaning that depending on which way you bend and move, the spine has kind of fused in that position. And that's important because every bone, 24 movable bones in your spine should move, okay? They should bend, twist, and rotate, with respect to the segment above and below. But in a structural scoliosis, it kind of has fused in that curvature. Now, those are usually associated with like later stage diseases, that are usually go along with other, joint dysfunctions. But when we're looking at kids, many times these scolioses in kids are functional. And what that means is if they're standing straight up and down, yeah, it's there. The scoliosis, the curvature is present. But then as soon as they start to bend forward, that scoliosis will actually start to straighten out because the joints are functioning properly. They are actually unwinding the curvature and coming back to more of a neutral position as they bend forward. That's a good sign. Okay, because the spine is moving very appropriately. So even though in a static standing position, you have this curvature, as you start to bend forward, it'll unwind itself. And that's where the motion x-ray assessment comes into play. And that's why, sometimes if you have someone who doesn't know what they're looking at or isn't very well trained in this, you could have someone that might be just on the borderline of a mild to moderate scoliosis curvature, but then as soon as they start to bend forward, boom, it goes away. They're like, oh yeah, you're good. It's like, well, those are things that we can monitor and assess. And then again, that's where the motion x-ray comes into play as well, because not just are we looking at you in static, but we're also having you bend and rotate. And many times, with the kids that we work with, if we, maybe see a scoliosis, but then we have them do some positional, biomechanical movements, and their spine is moving appropriately. Well, once we get their hips balanced, we're okay with that curvature being there, because that's obviously the adaptation in terms of a stress point that the body wanted to be in. So we're happy working with that. And again, there's other factors that we're looking at. We're looking at neurological factors with the infrared thermal scan, and we're looking at, posture, we're looking at strength, we're looking at several different factors, but there's several points that we're putting together to, get us the best outcome. So rather than, immediately jumping to, surgery, if someone is, 40 degrees or above, it's like, let's see what we can do to help strengthen the system to make sure that, we don't have to, rush to that surgery. Because if you've seen those, you can just Google scoliosis surgeries and you'll get images. And, sometimes it's just, you're just butchered, you're fused, because they have to go several segments above the curvature and several segments below. And they put these, it was called Harrington rod surgery, and they'll put a rod on one side and a rod on the other, and they forcibly straighten that spine out. Okay. The challenge with that is, now structurally you have a straight spine.
Now, like we just said, now you took away the motion.
Fuse your body. You've fused those segments, and they're no longer moving. Well, motion is key to to make sure that you have appropriate, not just movement of your body, but also movement of the spinal cord within the spine. Okay, there's a reason that the spine can move, and that's again to adapt us. But that motion of the spine, there's a lot of stimulation neurologically that stimulates messages up into the brain when you move a joint. It's called proprioception. The easiest way to think of proprioception, I talk about when people close their eyes. Put your hand above your head. Close your eyes, put your hand above your head, and wave it around. Well, guess what? You know what your hand is doing because of proprioception, okay? So there's messages in those joints and the small muscles surrounding the joints that are sending messages up to the cerebellum and the brain that are saying, hey, this is where your joint is in space. And that's when a joint is moving appropriately, it has the best level of proprioception, a healthy level of proprioception, so it knows where it is. When you fuse a joint like that, you really inhibit proprioception. Well, guess what? Proprioception works hand in hand with another property called nociception. And nociception is not a pain signal, but it's the precursor to a pain signal, okay? So if proprioception is at a healthy level, nociception stays low, and basically a good, healthy, movable joint is not going to be uncomfortable. As soon as you block that motion and proprioception comes down, now the message of nociception starts to rise. And too much, now that alone is not going to be painful, but too much nociception, once it reaches a certain threshold and you reach the boiling point, now the brain will start sending and communicating a pain message like, hey, this joint, this area is not moving. And now because it's not moving well, now it's going to start to become achy or pinchy or pain. So, and those are all messages that our body, again, can relate to. And that's why, that's why a lot of times people feel so good after, immediately or a couple days after an adjustment, because their
moving.
spine is moving so much more freely. And that's why I've had people come in with, maybe like they've stoved a finger or they twisted an ankle, and it's like, boom, we can immediately do an adjustment, unlock the joint, and it's like, they're walking out of there like, oh my gosh, I can't believe how much better that's moving. So in summary, because I already went into probably a lot more detail than we need, but in summary, we're not just looking at structural, even though that is very important with this scoliosis. But we're also looking at functional. How is the spine moving within that curvature? And there are cases that it might be moving just fine, and we can continue to monitor and keep it that way, with good, healthy adjusting. And again, the earlier you get your spine checked, just like the earlier you start brushing your teeth, less chance for cavities. Well, the earlier you get your spine checked, get it moving and aligned appropriately, the easier it is to keep it that way. And that's why I just find it so silly that people, not silly, but like people ask all the time, well, why would you see kids? Because again,
have you watched what?
First of all, have you watched what they just did for an hour and a half?
If adults hit their heads and fell as often as children.
Oh my gosh, we wouldn't be able to move. We'd all be in hospital beds. But yeah, you just watch kids, bend and move around, and that's what I always ask people back. It's like, when do you take your child to the dentist? When their teeth start popping through, so usually between the ages of 2 and 3, they're going to the dentist.
When you take them to a doctor for a wellness check.
So it's like, and again, your medical doctor, they know a lot of different topics. They know a little bit about so many different diseases. Yeah. But when we're looking at, the spine, your chiropractors are really, the experts of spinal alignment and motion. We've talked about this in so many other podcasts, and it's essentially the experts of what we do. It's like, the importance of your spine not just being well aligned, but well moving, functioning. That's what we look at day in and day out, and are the experts at helping you get to that good, healthy alignment and motion. And so, the intimate relationship between that spine and that ultimately your brain and nervous system, which is the master coordinating, communication system of the body, because those two are so intimately related, when we work on a spine from a very early age and we keep it that way, then you have a much greater chance of getting healthy or staying healthy, right? Yep. What's our quote in the office? It's much easier to raise healthy kids than recover sick adults. Yeah. So hopefully that was beneficial. There is some research, with the specific method of analysis that I use in the Pierce Results system, in terms of the analysis that we do for scoliosis and the results that we have gotten. So I could probably leave a link to those, or at least the summary of those. I don't think I can post the whole article because it's on a membership-based website, but I could leave the link to the summary of those articles on this podcast.
We do have a lot of information on our website as well.
Yes, we do. Absolutely.
Not just scoliosis, but if you haven't been on our website, we have, if you go under, your health, and it lists all these different conditions. And again, we link, how chiropractic can help with that. And it's, that, and ultimately, we're talking about scoliosis, which is directly affecting the spine. That seems like, you can't undo the surgery. No. So it always makes sense to start with the thing that's less invasive and see if you can get the results that you're looking for and function the way we've helped a lot of people with, like you said, with some pretty, significant
curvatures. And again, that doesn't necessarily mean that it's corrected 100%, but again, maybe it's gone from severe to moderate, or moderate to mild, or
even just maybe their neck's moving better, or maybe they're just, again, other things that have compensated are now functioning better, and
So, and that's, so if you've only ever gotten your child checked at the school scoliosis check, then I would encourage you, if you have any concerns or just are looking to rule out, like, hey, is this a problem? Could this become a problem? Hey, I'm just interested in making sure my child is as healthy as possible, or myself, I was diagnosed with a scoliosis and I still deal with problems. Like, you're just looking to get as healthy as possible and make sure that your spine is as strong as possible. possible, then you're going to be hard pressed to find a method of analysis that's going to be more involved in terms of making sure that we can get that spine moving and aligned as best as we can. So I encourage you to check it out, and as always, like Angela said, check out the website Turo, Turo, familychiropractic.com, and again, reach out directly if you have any questions for us. So we were joking at the beginning, like, oh, how much was Angela going to talk today? Probably. Maybe I could have done this one myself, but thanks for hanging out, Angela.
I'm happy to hang out.
There's been episodes on the the training stuff where I'm like, oh, I'm just going to sit here and let her talk because she's doing a great job. So hopefully she was thinking the same about that today.
No. All right. Thank you guys for tuning in.
See you next time.
You've been listening to What the Health with Dr. Dan and Angela Toro, brought to you by Toro Family Chiropractic. To learn more about the resources mentioned on today's show or listen to past episodes, visit www.whatthehealth.world.